What does a good threat modeling exercise look like, uh, or activities around threat modeling? What does that look like?
Sure. So threat modeling is very similar to the conversation that happens when you go through a business impact analysis for continuity of operations. The goal becomes is, hey, we have a solution that we're trying to implement for this reason for our business, for this clinical workflow, for this specialty. It has these pieces, X amount of pieces. So the threat modeling exercise goes through and figures out based on how the solution is built, where does it sit, how is it scaled, how is it accessed, what are the data flows in and out of that application, to figure out how badly can that solution be affected in terms of a security incident. And then on the flip side of that, once you understand that, you can actually then use the output of that exercise to color your risk management decision to say, great, this solution has APIs that are not really very well built. So I may have an exposure on the data collaboration, data sharing side. What does that mean for me? Do I have funding, for example, coming in on the reliance of that system being able to share data? We see that for clinical research use case applications as well. So that's what threat modeling looks like. It's looking at who has incentive to go after what's in the application, or the means to get into the application to cause not only data theft, but also either impact to integrity of applications, so the ability to change data, or the availability, which for health systems predominantly in that triad, the confidentiality, integrity, availability piece of it, sometimes availability and integrity trumps the confidentiality piece. So that's what threat modeling helps achieve.